The OPTIC study was a study that was designed with the intent to identify the best balance between the efficacy and the safety with various doses of Ponatinib. So the design was that patients that had received at least 2 prior tyrosine kinase inhibitors or who had the T359 mutation, this was for chronic phase patients, were randomized to receive the standard dose, which is 45 milligrams once daily, versus 30 milligrams once daily, versus 15 milligrams once daily. The doses were adjusted for safety, of course, but in addition, the study had a built-in dose reduction so that patients who reached the adequate response with the Ponatinib, if they were receiving 45 or 30 milligrams as the initial dose, they would automatically dose reduce to 15 milligrams daily once they achieved that response. So there was a sort of like an induction phase and then a maintenance phase once you achieve the response. And what we learned from the interim analysis was that there is a correlation between the efficacy and the dose. We did see good responses with the 3 doses. That's very good news. But we did see that the response rate was somewhat higher with the higher doses, and particularly true for the T359 mutated patients, where there seems to be more of a need for the higher doses. So there is that correlation. But another element of the study was to look at the safety. Could we decrease the concern about arterial-occlusive events and other events, but particularly arterial-occlusive events, with a lower dose initially? And the results show that indeed the frequency of these events goes up with the higher doses. Now, the magnitude of the change between the lowest dose, 15 milligrams, to the highest dose, 45 milligrams, in terms of efficacy is higher than the magnitude of the change in the safety concerns. That means as you increase the doses, you gain more in terms of efficacy than you lose in terms of safety. But there is some trade-off, no question. So what we established is that from the efficacy perspective, the highest dose seems to give you the best responses. By reducing the dose once you achieve a good response, you seem to reduce the incidence of these arterial-occlusive events because the incidence seemed to be lower than we would have seen in the PACE study. But it is something that still needs to be monitored closely for the patients to minimize their risk. The final results will be available when all the patients have completed the 12-month follow-up mark, sometime in the next few months, and that'll give us a more definitive answer. I think it is possible that it'll follow the same trend that we are seeing, and we feel confident about these interim results, but it is important to see all these patients follow for at least 12 months, and that is because the primary endpoint in terms of efficacy is the response at 12 months, number one. And number two, also to have enough observation for the safety aspect of the exposure, because we do know that continued exposure may participate in the risk of developing any of these adverse events. In terms of future research, we want to investigate what are the causes for these arterial-occlusive events, because as I mentioned, they don't affect only Ponatinib. They affect many of the other tyrosine kinase inhibitors. The frequency with the different inhibitors varies, but it does afflict many of them. So understanding the mechanisms and how we can prevent these adverse events so we can take full benefit of the potential efficacy of the drug is very important.